651, Senator from the Cape and the Islands, Senator Cyr, offers an amendment. The clerk will read.
Amendment number 651 by Mr. Cyr, childhood lead poisoning prevention.
The Senator from Essex and Middlesex, Mr. Tarr.
Thank you, Madam President, and good evening. It is so nice to be reconvened with you and the members of the Senate here tonight. Madam President, the subject of this amendment is very important, and I want to thank the gentleman from the Cape and the Islands for his work on the issue of lead poisoning, not only with regard to this particular amendment, but from the multifaceted approach that he has been engaging on this issue now for several months, if not several years. And I've been pleased to partner with him on a number of those initiatives. And I know that this is a situation where we need to continue to make progress. And I believe this amendment is a significant step in that progress. However, it has been through the redraftatron. And so I'm hoping that we can understand what I believe is a distillation of a larger amendment that had been present prior to the engagement of the redraftatron. So I'm hoping he can just give us an explanation about what exactly is in the amendment now before we consider it for further action. Thank you, Madam President.
Thank you. The Senator from the Cape and the Islands, Mr. Cyr.
Thank you, Madam President, and through you to my colleagues and the Minority Leader. Thank you for the opportunity to speak about childhood lead poisoning, which is something that this body has been tremendously committed to. So this amendment would call for a study by DPH regarding the revenue necessary for the agency, and specifically the Childhood Lead Poisoning Prevention Program, to provide all eligible children with the legally mandated services to prevent elevated lead levels under the Commonwealth's lead poisoning law. Further, we look to a comparison how other states with comparable housing stocks finance childhood lead poisoning prevention programs, and we ask that be filed to us by November 1st, 2019, which is a speedy timeline. But in Massachusetts, the primary pathway for lead exposure is through lead paint. Most homes that we live in were built before the elimination of lead paint in the 70s. I believe it's 78% of homes built before 1978 when lead was banned. So primary prevention, reducing or eliminating the myriad of sources of lead in the environment, especially for young children, children under 6, is essential to protect children from lead toxicity. Very high lead levels of concentration can cause significant overt systems, but we've learned more and more that almost any level of lead exposure, low lead exposure, also has a significant risk factor, particularly for diminished intellectual and academic abilities, higher rates of neurobehavioral disorders, and lower birth rate in children. So reducing lead exposure from residential lead hazards, industrial sources, contaminated food or water, and other products, this is the most effective way to prevent lead poisoning in children. We need to bring Massachusetts into the 21st century with our interventions, and we're doing just that. So actually, our Chair of Ways and Means, in his opening speech in this budget, referenced a $2.7 million investment into the Childhood Lead Poisoning Trust. We're also, as part of this work, we're working closely with the Minority Leader, my colleague from Salem, on looking to how do we safeguard water that may have lead and that exposure to young children. And what this does is this furthers information to make sure that we can ensure that the $2.7 million investment that we're making in this budget, that we're funding that in a sustained way to make sure that we are providing services for all children who are lead poisoned and have elevated levels of lead. A number of my colleagues in this chamber have been partners on this. I want to make sure I thank my colleague from Somerville, my colleague from Worcester, my colleague from Winchester for his leadership in public health, my colleagues from Boston as well. And I guess I'll just close and say, for me professionally, this is coming full circle, because I first started working on childhood lead poisoning prevention policy in 2011 when I was a mid-level bureaucrat at the Department of Public Health, and It's a real honor to be able to continue to partner with all of you to safeguard some of the most vulnerable children in the Commonwealth. If you look at the roughly 3,000 young children under 6 exposed to lead, most of them are in poor communities. A significant percentage of them are children of color. So this is a real social justice and social equity issue. I'm really proud of the Senate for our leadership on this. I thank all of my colleagues for their partnership, and I hope the amendment is adopted.
The question comes on the adoption of the amendment. All those in favor say aye, opposed no. The ayes have it, and the redrafted amendment is adopted. Amendment number 655, the senator from Norfolk